Okay, we have Ryan Salzman joining us once again this morning. The big topic this week is going to be health care, and even bigger still, how it will impact you. So we're going to break down exactly what's going on this week leading up to the July 4th recess. Good morning.
Good morning.
Let's jump right into it, because this is a big point of contention right now, not just for Democrats, but inside the GOP. Is the promise to repeal Obamacare getting in the way of putting together a comprehensive plan for GOP lawmakers? Are they rushing it?
Yeah, are they rushing it? Well, they have to get through this piece of legislation. They have bigger fish to fry, they may say, and I don't want to diminish the importance of health care, but they really want to get some tax reform done. And in getting that tax reform done, they have to find some money, like $1 trillion. And one of the ways that they believe that they can find some of that money, some of those savings, is in redoing the Affordable Care Act. So that's where we see the Medicaid support greatly diminished, in part, and I don't think they would ever go on the record to say this, but there's many pieces of information out there that say that what they're looking for in tax reform requires savings. Enter the health care reform bill.
Okay, so we hear that 23 fewer Americans will have insurance with this new plan. Specifically, you mentioned Medicaid, the reduction in that. How does this impact people here in the tri-state who even perhaps have a pre-existing condition? Yeah,
so pre-existing conditions. Right now, the piece of legislation, the bill that is, mandates the same coverage for pre-existing conditions. That is, if you have one, you cannot be denied. And this is the Senate version of the bill. And also that you can't be charged more money. And I know that that seems to not really comport with what we've heard, but that's because there's a waiver that's being put in it where states can opt out of that. So while the bill says you have to do it, they're also putting in a mechanism for the states to not have to do it, and we know that the bureaucracy will be pushed to recognize the waivers that are sought by the states. So what does that do? You have diabetes. Some people say that if you were to have had a child, that counts as a pre-existing condition. If you were born with a heart murmur, that could be a pre-existing condition. So going back to this debate from 2008 into 2009, or excuse me, mostly 2009 into early 2010, is that if you have a pre-existing condition, you're now potentially going to be left back out in the cold, and of course that can affect millions and millions of individuals and hundreds of thousands potentially here in the tri-state.
Do Americans even want this change? I mean, I know we've heard so many from each side, but what do the polls say?
So the Affordable Care Act, Obamacare, most people want it to be changed. That is true. But now that we have this alternative on the table, it appears that people are getting very comfortable with Obamacare. For the first time in some of these tracking polls, over 80 weeks or so of tracking, so multiple years, or if they were done every other week or monthly. So over the last 6, 7, 8 years, mostly the approval rating has been below 50%. For the first time in the history of tracking these bills, we're now finding Obamacare has over 50% support. And again, I think that people want Obamacare to be changed, but they're not, it doesn't seem like they like the changes that are being offered right now.
Yeah, a lot of people concerned this is definitely a flawed policy, and we'll see how it plays out because they go on break by the end of the week. Ryan Salzman, we're going to check back in with you to see what does happen this week and get your perspective. Thanks for coming in today.
Thank you.
Okay.